Welcome back. Vaccines save lives by preventing outbreaks of contagious diseases. They provide immunity to individuals and even to whole communities when the majority of the community is immunized. So here to tell us more about vaccines and their importance, Dr. Julie Marfell from Frontier Nursing University, and thank you so much for stopping by.
Well, thank you very much. This is a really important message, and I'm happy to get it out there.
Well, we were just talking about the outbreak of flu, and that's just one of many vaccines that are very important for people to get.
That's exactly right. There is, from the time a child is born until you are over the age of 65, I mean, all age groups need to look at what their vaccines are, whether or not they're up to date. We think about it, I think, primarily with children because we go through that whole series, and then you have a series with school.
Right.
But adults need to really remember that they need to check whether or not they're up to date on their immunizations as well.
Right, because I think a lot of people think, well, as soon as you get the ones required to go off to college, you're good, right? You're done. But that's not necessarily the case.
Not at all. And, you know, I have, in my career, seen several cases of tetanus here in the United States, and it's all been related to a gardening accident. You know, not a bad accident. Somebody stepped on a rusty nail. Someone had, like, gotten a tomato steak in their hand, and they were not up to date on their vaccinations. And it was a small enough injury that they weren't too concerned about it, which led to hospitalization.
Oh, my.
So
okay,
you have to be careful.
Well, it's a good example because I know so many people who are out there in the garden, and how many of them are thinking about the last time they got their booster for tetanus. So we were talking a little bit about the community health from vaccines. So I hear a lot of the argument for those who are anti-vaccine saying, well, I don't want anyone telling me what I do with my body or my child's body, but it really is something you have to consider for the whole community.
That's exactly right. It's a herd mentality. You know, you want to protect the herd, so the more people that you have that are immunized, the better, the less the chance there is that there's going to be an outbreak of measles, whooping cough. Those are the things that we still see today. Right. Frankly, the flu, the more of us that are immunized for the flu, the less the chance that we're going to be sick, the less the chance that we're going to miss work. Right. People who have chronic illnesses, and I don't know if people really think about this either, is that if you have diabetes, hypertension, asthma, you definitely need to get a flu shot. Because if you get the flu, it's going to be harder on you. Right. People who are over the age of 65, anybody that's had a cardiac event in the last year, should make sure you get your flu shot because you don't want to be sick.
Well, the thing that I try to remind people of, if you know, preventing something that may happen isn't incentive enough for you, think about the money. Think about the money lost when you miss work, when you have to go to the doctor, when it may eventually lead to hospitalizations. Right. That is one way to justify getting it, and many times you can get it for free or at a reduced cost.
Absolutely. You know, I don't know if you noticed around town, but there are billboards up already everywhere talking about getting your flu shot. You know, if you Google the flu right now, it'll come up. There's no excuse. There's plenty of places for access. I mean, there's this whole theme. And there are. I frankly got my flu shot last year at the pharmacy. And, you know, we nurses, we pride ourselves on giving good immunizations. So I was skeptical. One of the best shots I've ever gotten.
Hey, so there you go. When they're used to giving a lot of them, it's quick and easy.
Right. That's exactly right.
And it takes a couple weeks before that immunity kind of works in,
Exactly. 2 weeks is what they say. So go out and get it now. With these cases already showing up, it's time. It really is time to do that. And I know there's a lot of controversy about immunizations, but I have to tell you, all the credible evidence points to the importance of being immunized. So I really would recommend that people take a good look at their sources when they're trying to make a decision and make sure they're evidence-based. Anything on the web that's .gov, .org is going to be much more evidence-based than anything that says .com.
And you can go online to also find a schedule of the immunizations you should be getting throughout the course of your life, not just in childhood. Yes, we do have to still get them. So Dr. Marfell, thank you so much for coming and letting us know more about this.
You're welcome. Thank you.
Of course. We're back with more for you coming up after this.